Hello, hello, hello. For mine, Juan, and Syed's second capstone, the disease we decided to focus on is atherosclerosis. Now, just what is that? So, atherosclerosis is the condition of deposits such as plaque of fatty material, lipids such as cholesterol and triglycerides, hardening on the inner walls of the arteries. Ather is Greek for thick plaque and lipid-rich material. Scalar meaning hardening, osis, condition of. So, here are some statistics about this disease. 1 in 5 people, or 4.6 billion people, have developed atherosclerosis. People who develop this disease are twice more likely to suffer from strokes. People who develop this disease have a nearly 30% increased chance of suffering a heart attack. And it's a leading cause of death in Australia. So, for some symptoms common, anything that isn't a source of pain or death. So we have fatigue and shortage of breath. So as the plaque blocks blood flow in our arteries, it prevents oxygen being spread throughout the body. So so exercise will have us winded more quickly. But not only that, muscles are more quickly to wear out under stress or work. And with that blood supply hampered, it also prevents wounds such as cuts and bruises from healing quickly without that blood supply. Dry skin. Without that oxygen supply, people are more likely to have dry skin, which leads to skin tag development. So, without that oxygen supply through the skin, it'll dry out and basically rub against itself, creating almost lumps. It would be a dark lumps to describe it. Well, generally harmless. They tend to grow all over the body, which will require some treatment in order to reduce them back into dead skin. Symptoms: moderate. Numbness. So, without a blood flow throughout the body, people's limbs, neck, and other extremities may feel tingly, as you would sleeping on your arm after waking up. While not two source of imminent death, it's also a bit of a telltale sign that a heart attack or stroke may occur as the as blood accumulates just before the blood ruptures throughout the body and harms vital organs. The numbness cuts off circulation. Loss of hearing. Like I said before, numbness. People with this disease may have a hard time hearing because of that circulation being cut off in the head. Pain during walking or exercise. So, aside from being worn out, muscles are more likely to tear during work without that blood supply flowing. Slurring. So, as mentioned before, atherosclerosis cuts off blood supply throughout the body, and it's really dangerous if it gets near the neck or brain. As people's speech becomes very difficult without the blood supply to speak properly. Vertigo. Similar to before, people with this disease may have a difficulty finding balance and like in our blood pressure lab, getting out of bed too fast might send these people unable to get up from the blood rushing. Symptoms: severe paralysis. So, People with disease symptoms severe paralysis. People with atherosclerosis may have suffered strokes or heart attacks, leaving them with a limb unable to move. It is not uncommon to have people have limbs amputated from total loss of use of their limb, total loss of vision. Over time, if not dealt with properly, it is possible from the loss of circulation to cause of someone to become completely blind. Total loss of hearing, as mentioned before, if not dealt properly, the ear will be unable to function if left untreated for too long. Loss of speech. If a stroke isn't immediately lethal, it'll leave a person forced to recuperate and learn how to talk and walk all over again. And even prior to that, a person can lose their ability to speak if the blood flow to the brain to certain parts of the brain is cut off. Elevated blood pressure. Generally, one of the most dangerous symptoms. With the arteries blocked off, blood pressure is way more easily elevated, causing the severe elevated risk of heart attack and strokes. Moving on to the mechanisms of this disease development, Juan.
Thank you, Nathaniel. Now we'll be discussing the pathogenesis of atherosclerosis. This is the mechanism in how plaque builds up in the arterial walls and can block or impede blood flow through the body. The dysfunction of the endothelium. There are several factors that can cause degradation of the endothelial cells that line the lumen of the blood vessels. We will be focusing on hypercholesterolemia, which are high levels of cholesterol in the blood. These LDLs, or these low-density lipoproteins, which are bad cholesterol, will migrate into the tunica intima through receptor-mediated endocytosis. At the same time, we will have leukocytes that will adhere to these receptors through this leukocyte adhesion cascade. They basically just go from cell to cell until they're able to latch onto a receptor. Then, through a process known as diapedeusis, these monocytes will also migrate into the intima. Once in the intima, the monocytes will differentiate into macrophages. These macrophages will secrete free radicals and these ROS, which are reactive oxygen species. These help the LDL oxidize into the molecule. Once in this form, these macrophages can consume the oxidized LDL, and they start to turn into foam cells. These foam cells contain a number of these low LDLs, which are basically lipids, fats. Once these cells form, they will secrete cytokines that will attract more monocytes into the intima. And then there they differentiate again into macrophages, and they secrete more of these ROS free radicals, and then more LDL becomes oxidized, and then more macrophages will turn to foam cells, and the process begins again and again, and this is considered a positive feedback loop. Migration and proliferation of smooth muscle cells. Another thing foam cells do will start to secrete growth factors. These growth factors will attract smooth muscle cells from the tunica media. They will migrate into the tunica intima. Once in the tunica intima, they start to proliferate and multiply. As they are multiplying, they will start this collagen fiber synthesis, and they will attract collagen fibers and elastin into this area. At the same time, we have foam cell apoptosis. These foam cells will start to die, and they will deposit their fatty contents into this area. And so what we get is basically a sort of cap of collagen fiber and elastin that covers sort of this area where the growth is happening. And also we get the deposit of lipids from dying foam cells. And so we get big chunks of fat, of lipids, and we get this tissue, this connective tissue that's elastin and collagen. Until we get something that looks like this. We also start to get this vasovasorum neovascularization, which is basically small blood vessels for blood vessels. And as the body senses that there are more smooth muscle cells in the tunica intima, these small blood vessels will start to form. And so you can just imagine how we have this collagen elastin cap, and we have a bunch of fat, we have the smooth muscle cells, we have this neovascularization, and we also get calcium salt deposition in this plaque. So this plaque will start to harden due to calcium. And as it gets bigger and bigger, it will eventually rupture. Once this ruptures, it's considered a thrombus. And a thrombus can either cause an occlusion, a blockage, or it can impede blood flow. And blood will slowly trickle in between here, or it will stop all of a sudden. Basically a block. And here we can see what a normal blood vessel looks like, and then we can see what a blood vessel with this hardened plaque looks like. And here we have some common arterial occlusions. One of the main ones is the coronary artery. This coronary artery can lead to myocardial infarction, heart attack. There's also the angina pectoris, which is chest pain. And in the carotid, we can get strokes if there are any occlusions, and cerebral atrophy. Some of the blood flow, lack of blood flow will start to kill off tissues and necrosis. In the renal artery, we will have increased renin. And so the renin, the angiotensin, and aldosterone complex will increase blood volume, which will then increase blood pressure, which will give you hypertension, which can further degrade the endothelium of the vessels. And another one we could have here is the popliteal artery. The popliteal artery is essentially peripheral ischemia or peripheral occlusions, and this impedes blood flow to the extremities. Eventually, they could be amputated. And now I will pass it over to Syed, and he will finish this presentation. Thanks, Syed.
Thank you. Thank you, Juan, for completing the mechanism slides. So I will continue with the risk factors. Some risk factors can't be changed, such as family history of premature cardiovascular disease, older age, men age 45 and women age 40-55. Some medical conditions raise the risk for atherosclerosis, diabetes, high blood pressure, high cholesterol, obesity. Lifestyle factors also play a role, such as smoking, lack of physical activity, a diet in saturated fat and trans fat, cholesterol, sodium, as we know as salt, and sugar. The next slide covering atherosclerosis complications. Complications of atherosclerosis depends on which artery is blocked. There are some diseases such as coronary artery disease. Atherosclerosis narrows the arteries close to the heart, causes chest pain, angina, heart attack, or heart failure. Carotid artery disease. Atherosclerosis narrows the arteries close to the brain, either side of the neck, causes transient ischemic attack, TIA, or stroke. Either side of the neck, there are carotid arteries. The next one is peripheral artery disease, a circulatory condition in which narrowed blood vessels reduce blood flow to the limbs. It is a sign of fatty deposits, and calcium building up in the walls of the arteries may cause leg pain. In this artery, you can see there is a normal artery. There's a artery with atherosclerosis, and there's a plague. And these are the effects atherosclerosis have on the body, throughout the body. The next slide is continuing with the atherosclerosis complications. Aneurysms is a bulge in the wall of an artery, usually form in the belly or chest portions. More serious threat of an aneurysms is when it bursts, may cause a stroke, or massive bleeding can be life-threatening. Example, abdominal or aortic aneurysm. Here in the picture you can see there is a bulging of the artery. The next disease is chronic kidney disease. Renal artery stenosis caused by atherosclerosis, less blood reaching the kidneys. The body misinterprets low blood pressure, signals the release of hormones from kidney to increase blood pressure. Over time, renal artery stenosis lead to kidney failure. So here is the picture. You can see renal artery stenosis, where there is a narrow artery. Now there's less blood flow can happen. The next step is diagnosis methods. So some of the methods we already know, like blood test to check blood sugar and cholesterol levels. Then next one is electrocardiogram, a simple and painless test that records electrical signals of the heart. And this is also one of the common ones nowadays. Exercise stress test. A patient walks on the treadmill or stationary bike while connected to the ECG. Exercise makes heart pump harder and faster than it does during most of the daily activities. An exercise stress test can reveal problems within one's heart that might otherwise be missed. The next is echocardiogram. A test uses sound wave to determine how well blood moves when the heart beats and through the arteries. Here's the pictures of the electrocardiogram. The next one is exercise stress test and the echocardiogram. Continuing with the diagnosis methods, Doppler ultrasound, special ultrasound to measure blood pressure at various points along arm or leg to determine the degree of blockages and speed of blood flow in arteries. The next one is ankle brachial index, ABI, abbreviated as ABI. ABI test compares blood pressure in ankle and blood pressure in arm. Any abnormal difference may be a sign of peripheral vascular disease, usually caused by atherosclerosis. And then here's the pictures that we can see, Doppler ultrasound, and then ABI, and then the last one is cardiac catheterization and angiogram, a test to determine if coronary arteries are narrowed or blocked. Here's the picture for that. During the procedure, the doctor inserts a thin flexible tube catheter into a blood vessel to the heart. Dye flows through the catheter. As the dye fills the arteries become visible on X-ray, revealing areas of blockage. The next diagnosis method is coronary calcium scan. Common tests use CT imaging to create detailed pictures of the heart to determine calcium deposits in the artery walls. Other imaging test is MRA, magnetic resonance angiography, and the other one is PET scan, which is positron emission tomography. So these tests can determine hardening and narrowing of a large arteries. MR specifically examine blood vessels. Here's a picture that shows calcification of the coronary artery, and there's image of that, and MRA. And here is the PET scan where you can see narrowed artery and area of impaired blood supply. Moving on to the treatments, starting with the medications. Most of the medications we know, we are familiar with. So cholesterol medications. Aggressively lowering low density lipoprotein, reducing inflammatory response. Example, simvastatin. Blood thinners lowers the viscosity of blood, reducing the risk of platelet clumping in narrowed vessels. Example, aspirin. And the next is blood pressure medications. Reduces the risk of damaging endothelium of blood vessels, which can lead to a myocardial infarction. Continuing with the treatments, here's the next is angioplasty and stent placement. This procedure also called as percutaneous coronary (PCI), helps open a clogged artery. In this procedure, the doctor inserts a catheter into a diseased artery. A second catheter with a deflated balloon on its tip is passed through the first catheter to the blockage. Then the doctor inflates the balloon, widening the artery. A mesh tube stent is usually left in the artery to help it open. Here's a picture. We can see how this procedure works. Here's the balloon catheter inflation. The balloon is inflated, and here's a stent. And the next one is endarterectomy. Procedure is done to remove plaque buildup from narrowed arteries in the neck. Here's the carotid artery, which is incision in the neck, and then carotid artery, the plaque is removed. Treatment. Continuing with the treatment, fibrinolytic therapy, also called as thrombolysis. An artery is blocked by a clot, can be treated by use of clot dissolving drug to break it apart. Other way to break the clot through a catheter or thin tube that has been navigated to the site of the clot. The next one is coronary artery bypass surgery, open heart surgery. Healthy blood vessel from other part of the body is used to create bypass around the blocked artery to redirect the blood flow of blood. Here's a picture of thrombolysis through medication and catheter. And here's a picture of bypass surgery where you can see the difference of the surgery where an artery from a different part of the body is used. The next slide is the last slide, is the prevention. How can we prevent or lessen atherosclerosis? We may not prevent atherosclerosis, but certainly can make an effort to reduce the risk and effects of the disease. Steps to follow: healthy diet, exercise regularly, keep a healthy weight, manage any health condition. Manage any health conditions, especially diabetes, high blood pressure, and high cholesterol. Quit smoking. Have an annual checkup by primary care provider. So the next slide is the citations. I hope this presentation was useful and hope it is liked. Thank you.